Now, to examine Spain's performance in dealing with the pandemic, as well as looking at the international response, we can now speak to the Spanish Foreign Minister Arancha Gonzalez, who joins me now from Madrid. Thank you for joining us, Minister. Listening to Kim Torra there, he thinks that Spain's lockdown does not go far enough. What is your response?
Well, my response is that we've got 47 million Spaniards confined to their homes. They can only leave their homes to buy basic needs, medicines, or to perform essential work. So this is one of the stringent lockdown measures in Europe and recognized as such by the World Health Organization. So if this is not a serious measure, I don't know what a serious measure looks like. I think this is the time not to engage in I do, you do, but rather in uniting, in providing a response to the coronavirus in Spain. Citizens in Spain, 47 million citizens, are being responsible. What they ask from governments, central government and regional governments, is to be as responsible as they are being. So I hope Mr. Torra is listening.
But you use the word responsible there. I've been asking your public for questions that they would like to ask you. I had one response from a gentleman called Javier who says that he wants to know whether you are going to reinforce those measures when it comes to lockdown, because some people, he says, are not taking them seriously enough. We need more co-responsibility.
It's true that at the end of the day, what we need is citizens to behave. And citizens are by and large behaving. But for those that are not, the army has been deployed across the country to make sure that they ensure citizens stay at home. And those that do not get fined, and when they get fined, they go back into their homes. So by and large, this is harsh. This is not something that any country wants to do, but by and large, I think this is working. And I want to applaud the Spanish citizens for doing this by and large, because through their extraordinary behavior, we will be able to beat coronavirus. And that's what it matters at the end of the day.
And I'm sure they'll appreciate your optimism. And you specified this is not a time for finger pointing, but there has been concern from some members of your public that Madrid, which many considered to be the epicenter of this crisis in your country, was not locked down soon enough.
Well, I think we've got three areas in the country that show higher numbers: Madrid, the Basque Country, and now Catalonia. And what we are doing is deploying special efforts in these three regions, ensuring that the healthcare system, our public healthcare system, amazing healthcare system, responds in a specific manner in these three regions, because it is under more acute stress in these three parts of the country. This is where the three parts of the country where some hotels have been now converted into hospitals, and where specific healthcare measures are being taken. But again, by and large, within the plans that the government has deployed, central government together with all the autonomous communities in Spain, let's not forget that Spain is a decentralized country. Every region is shouldering in and should shoulder in into providing a hefty response to fight the coronavirus.
Your country is one that has faced a significant degree of austerity in recent years, and many believe that this has impacted your healthcare system. Is your healthcare system, Minister, ready to take on this challenge?
Well, the healthcare system is a public healthcare system. It's one where the country as such has been investing heavily in recent years. And yes, during the austerity measures, we had to operate cuts here and there. But by and large, this is a robust system that is showing its resilience now. But if there is one lesson that we need to draw from this crisis, is the importance of investing in public healthcare systems. This is a measure and this is a lesson for countries across the world, not just Spain, which has been by and large investing, but others that maybe were less inclined to invest into protecting public services, public healthcare services. This is a lesson that we will need to draw and on which we will have to reflect very carefully as we exit the coronavirus crisis.
We know in countries like Italy there has been an acute lack of devices such as ventilators. We understand that the EU is blocking the export of vital equipment such as ventilators. What contingencies do you have in place should, if predictions are to be true, you face a crisis like Italy in the coming weeks?
Well, we have a good stock of products. We are purchasing more. We are purchasing significant number of medical and sanitary equipment. We are doing this all across Europe, but also outside Europe. Our main concern is now that every hospital is equipped with the necessary means to fight the coronavirus. We've got incredible resilience from our doctors, our nurses, our medical personnel. They are working round the clock, and I want to publicly thank them because it is also thanks to their extreme efforts that we will be able to exit this crisis. This is a conviction that we have. It is not only a conviction that we have, it's a fight on which the entire country is embarked at the moment.
And I'm sure globally we share that gratitude towards healthcare workers. I did have another question from a gentleman called Frederico. He says, has the international community, both within the EU and outside it, been cooperating and coordinating well, or are there signs that it is more likely that it is every country for itself? What are you finding, Minister?
Well, I think there are things that each country has to do. Healthcare is a very decentralized policy. Every country has to fight this at home, but there are also a number of measures that need to be taken in a more coordinating manner. Some of them we have seen. We've seen, for example, a coordination of the financial and economic measures within the European Union. More needs to be done. This is why the President of Spain, Pedro Sánchez, recently called the chair of the G20, Saudi Arabia, to convene a leaders' meeting, a G20 leaders' meeting, in order to ensure a coordinated response that would give markets, but would also give citizens the sentiment that there is someone in control. Infuse confidence in markets, infuse confidence in citizens. Saudi Arabia responded positively. We will have this G20 leaders virtual meeting next week. We want to thank the Saudi Arabia presidency for doing that. It's important that all countries stand together, united. That's how we will convince markets, but more importantly, convince citizens that we are working to provide an end to this crisis.
Minister, we know that the elderly are severely affected by this should they be infected by COVID-19. There have been some reports in the Spanish media highlighting concern about Spanish care homes in which the elderly are living and that they are not receiving sufficient care, that they don't have ambulance services. What is your response to those people who have been contacting the Spanish media saying, help our elderly, help our care homes?
We have a very robust care system for the elderly. It is true that we are seeing coronavirus affecting in a very particular manner older people. This is why we have been taking measures to ensure that we avoid contagion of elderly people who are in homes. And just yesterday we took another package of measures specifically aimed at providing means, financial means, but also sanitary and support means to homes. Elderly people. Spain is a country with a lot of elderly people, and we need to care in a particular manner about them, protecting and preserving them from the impact of the crisis.
I mentioned in my intro there that researchers say that Spain is 6.5 days behind Italy. You have now become the 4th country globally to register more than 1,000 deaths. Your country is hugely worried. In terms of a timeline, we have heard here in the UK, our Prime Minister say we can have this under control, we can be on top of this within 12 weeks. What is your country's timeline?
Well, we hope to see a flattening of the curve of contagion in about 2 weeks. That's the prognosis we are working with at the moment. And we certainly are taking every measure that we can for this to materialize. But at the end of the day, this will rely heavily on a coordinated approach by a whole of the government approach, as well as the responsible behavior of citizens. This is the strong message we are giving. If we unite and we stay together, if we all row in the same direction, we think we can get the curve to flatten in about 2 weeks. That's our hope, and this is where we are putting all our energy at the moment.
Arancha Gonzalez, Foreign Minister for Spain, we thank you for taking a bit of time to speak to us. Thank you.
Thank you.